Any questions, feel free to type them in at the very end. I certainly will get to, if not all, then most of the questions. Just to let you know, you were actually sent an email today, and that email has some great information. One, it was a reminder about tonight's webinar. Every couple of months, we pull a report for the month and sort it by highest percentage of savings. And once again, an incredible report that you can share with just about anyone out there. It comes in 2 formats, in Excel as well as PDF. You can download it 2 different ways. And it's easy to get to. It's in your back office. Bring that up if I can. There it is. Your agent back office, under your library, you would simply click on RxCut and then top prescription savings. The last one we did was from December. The current one is from March. As I mentioned, it is in 2 formats, and it's pretty awesome. The first drug, if you just look at that, it'll blow you away. It had a retail price of over $442. Our card holder paid $4.50 just by producing our card at the counter. That's all he had to do. Saved $437 and change, almost 99% off of retail. And you'll notice that not all these pharmacies are independent. Some of the big 3 have some pretty drastic savings as well. Some of the dollar savings are incredible. $1,400, only paid $57. Paid $79 for a $1,628 medication. I have no idea what that is. Anyway, at the bottom, we sum it up, and the retail price for these drugs, for just 100 drugs, was over $35,000. Because of our card, members paid only $2,100 and change, saved over $33,000, an average savings of 94%, or an average savings per script of $331.88. They're real transactions at real pharmacies using the award-winning RxCut card. Feel free to print that out, carry it with you, use it if you're bringing on other agents as a selling point, or maybe trying to convince a healthcare provider or a nonprofit to come on board and distribute our cards as well. RxCut is our bread and butter, but guess what? Quickly growing is our voluntary product. So tonight, it's all about getting some relief, get benefit relief. Our agenda tonight, we're going to talk about those 3 dirty words, healthcare reform, and what it's really done to the healthcare industry. We're also going to talk about our voluntary get benefit relief products, what we've done in order to combat and help ease the pain of healthcare reform. We'll talk about compensation, because of course that's important as well. We'll take a quick tour through the back office materials for GBR and the GBR site itself, which everyone has their own personal GBR site. How and who to market, and we'll do a little Q&A at the end. So if you can hold on about 15-20 minutes before asking any questions, I may cover it during tonight's presentation. So wait till towards the end so I don't have to read through unnecessary questions. So healthcare reform. Well, everybody's calling it today the Unaffordable Care Act. And just to let you know how expensive it is if you have to go through the exchange, I did this a while back, but I just ran these numbers today. I went through the local Blue Cross Blue Shield, which is Horizon of New Jersey, and I selected the EPO Bronze program. This is for a family of 3. My monthly cost would be $1,600 and change. That's over $19,200 in premium I pay each year. And it doesn't end there. It's a 50% co-insurance plan. I have personally a $2,500 deductible, family deductible of $5,000. Now, unless I'm seriously ill and go to the hospital, I'm not spending $2,500. This hasn't happened in years and years and years, and I don't foresee it. So it's really an insurance policy that you'll probably never use, and that's why insurance companies make money. Maximum out-of-pocket, $6,300. $12,700 out of pocket for the family. But this is the part that really blew me away. Doctor copay, $30. Specialist, 50% co-insurance. So if it was a $400 doctor office visit, I'm paying $200. And this is the part that really got me. My generic prescription coverage and my brand, after I meet my deductible, I'd be paying retail until then, is 50% co-insurance. And you've seen some of those drugs. $450 where a member paid $4.50. I'd have to pay $450 for that particular drug I just showed you instead of $450 until I hit my deductible, and then it would cost me $225. Anyone want to pay that? I don't think so. So that's why our card is worth even more today than it was yesterday. It's even more invaluable. unprecedented increases to insurance premiums, some upwards of 30% plus. Soaring copays and deductibles as well. In fact, in the last year, the average copay has increased 34%. Once again, unprecedented. And now there's limited coverage with large gaps. It's the only way employers can help keep plans in check and premiums in check. And long physician wait times on an overtaxed healthcare system, primarily because 8 million newly insured people just came through Obamacare, another 25 million on the doorstep. And the reason there's no growth in physicians is the cost of education. It's absolutely astronomical today, and doctors don't make what they used to. So they spend half of their lives paying those loans back, plus malpractice insurance is through the roof. So now a lot of young, smart individuals are going into science and other fields. So what we did about a year and a half ago was assess the current healthcare market. We identified the gaps and lost coverage, and we rebundled our voluntary benefit products, which really we didn't do much with before, but now they're flying off the shelf. The demand for discount medical programs is absolutely booming. Google it. Voluntary products are up over 100%, and that will continue to trend up. Consumers need alternatives to traditional insurance. So we launched 4 products to address these market issues, because GBR delivers timely products that anyone can afford, and it saves time and money, and from an employer standpoint, could also increase employee productivity. The first standalone program is Aetna's Dental Access, which is the largest provider network in the industry. It's actually Aetna's PPO plan, over 132,000 practitioners, including everything from general dentistry to pedo, which is pediatrics, ortho, perio, endo, and prosthodontics, implants that would be. Savings of up to 50% on everything from routine cleanings right through extractions, molars, crown work, root canal, and implants. The nice part about this, unlike insurance, it has no maximum benefit. Most insurance plans, you're paying $40, $60 for family coverage, maybe higher per month, and you have a maximum benefit of maybe $1,500, if you're lucky, $2,000. Our program is just $595 per month for the entire family, and that's a household of up to 8 people. There's nothing priced like it out there today. In fact, go to Aetna. They sell this program for $19 an individual, the same program, and $24 for family coverage. And check out AmeriPlan too. They're pretty expensive as well. The next standalone program is Coast to Coast Vision. Once again, a very robust network of over 12,000 locations in the network. All the major chains like Sears, Walmart, I should say, Four Eyes, and they range from ophthalmologists, optometrists, independent optical centers, and obviously national eye care chains. They actually give plan members up to 60% savings on everything from eye exams right through LASIK surgery. Once again, just like the dental plan, there's no maximum benefit per year, and it's just $595 per month for family coverage. The next program is GBR Select, where we bundled Aetna's Dental Access and Coast to Coast Vision, along with hearing aids with discounts of up to 60% off retail. Now, I've read this a few times just over the past month or so. The need for hearing aids will increase over 100% over the next 10 to 15 years. And actually, it's increasing every year now. And you can blame that on those earbuds, because I kind of listen to them loud myself. Also included in this Select program is vitamins and supplement discounts. And this program is just $9.95 a month for a family of up to 8 in that household. Where the best bang for the dollar is right here, GBR Select. This is our flagship product. We sell 3 times more of this than anything else. It includes dental, vision, hearing aids, and vitamins, just like Select, but we've also added Health Advocate and the future of healthcare, Teledoc. So Health Advocate basically is the brain trust, the former brain trust of U.S. healthcare, and they saw the complexity within the healthcare system, so they put together 3 money and time saving products. One is Medical Bill Saver. Perfect example today. I had one of our agents that's been with us for years email me this morning to explain that his son had a procedure that cost $5,000 and was uncovered. He immediately got in touch with the folks at Health Advocate. They told him what he'd have to submit, so he's getting the paperwork and all the bills over. And they can actually reduce bills on your behalf with no pass-through charges of 25 to 50% off the original bill. They have a 95% success rate. That's because providers don't want those bills to go to collection where they're just getting pennies on the dollar. These folks have been doing it for years. They're great at it, and they take it right off your plate and out of your hands and resolve the issue. Now, most other medical bill saver type products out there come with a percentage of the savings that you have to give back, but this is all included in the low monthly fee on GBR Plus. In addition, Health Advocate also includes medical health advisor. So if you have health insurance and you have an insurance issue, whether it be a denied claim or you're looking for a second surgical opinion or a billing issue, you have to resolve that during business hours from 9 to 5. Well, not with medical health advisors. These experts all have backdoor access with all the carriers. They will take your issue and resolve it for you, take it off your shoulder, the burden of that while you get on with your life. That in itself is a great standalone product, and one that many health insurance agents buy for their clients because it relieves them of having to allocate a lot of time straightening out bills and denied claims. The other part of Health Advocate is 24-hour nurse hotline. Well, if you have Teledoc, why would you need a nurse hotline? Well, you may have questions like drug-to-drug interactions, maybe things that really don't meet the conversation level you'd have with a physician. So this service gives you 24/7 access to speak with a registered nurse who can touch on more than 1,200 different topics. And the spearhead of GBR Plus, and this is the future of healthcare, is Teledoc. Teledoc basically gives its members 24/7, 365 access to a U.S. board-certified physician, an entire network. And the reason we have chosen Teledoc is because, one, unlike other telemedicine companies that charge a per-call fee, this is unlimited calling for the entire family. It doesn't matter how many calls, there's no per-call fee, all covered by the monthly premium. We also love Teledoc because obviously they can diagnose non-threatening issues. In fact, about 70% of what people typically go to their primary care, even the urgent care or ER for, they can resolve with a 15-minute phone call or Skype conversation with a physician. They can even call in prescriptions as long as it's not a controlled substance or a narcotic. They can even do refills as well. So we love Teledoc because their physicians have an average of 16 years experience, and Teledoc is the only company that has its physicians re-credentialed every 3 years by the National Committee for Quality Insurance. No one else does that. The other thing we liked about Teledoc, it has a full staff of pediatric physicians. And the average wait time is under 15 minutes, which is an industry low. Some other companies out there, you're waiting an hour, hour and a half. Right now, it's averaging under 15 minutes for a callback from one of their board-certified physicians. So GBR Plus, it's definitely the best value. It's dental, there's dental access, coast-to-coast vision, Teledoc, Health Advocate with those 3 services, hearing aids, vitamins, and the award-winning RxCut discount card, all for just $12.95 per month for complete family coverage. Check anything out on Google, go to any website you want. You will see no programs that has the comprehensive products and services this does for those kind of price points. So compensation, you want to get paid, huh? Well, sure. Well, there's 2 different forms of compensation. The standalone products, both the dental and the vision, pay over 40% of the premium. We're charging only $5.95, and we're paying out $2.50 for personal production. If you have any agents you brought in under you, you get a 40-cent override on all their sales. With Select and Plus, they both pay $3.50 per month and an override of 55 cents. Doesn't sound like a lot of money, but guess what? You make this money each month for over 2 years because that's the average stay in these programs. So if you can sell 100-plus programs, that's $350 per month for at least 2 years. That's a half of a car payment anyway. So markets to prospect, well, I mean, everyone is a great prospect for this particular product, even those that are insured. Individuals, those you know, friends, family, neighbors, coworkers, and colleagues. I'm sure if you work with someone, you know the kind of coverage you both have, and I guarantee it's not telemedicine. Acquaintances, anyone you meet. Through social media, a lot of you folks are starting to do a great job pushing your RxCut site and your business opportunity site because we see all the hits coming in from Google, from Facebook, from LinkedIn, from Twitter. Now you can push your Get Benefit Relief site out there. If someone signs up online, it rolls right up to you. Business is really where to spend your time because you can sell in volume. Small to medium employers, especially those who don't provide benefits or have the very bare minimums in place. Hospitality is an absolute great place to stay and spend your time because a lot of those businesses like hotels, restaurants, bars have a lot of part-time employees and just do not provide those type of benefits. Retail, most of those people are part-time. Labor-intensive businesses and seasonal businesses like landscapers, construction, nonprofits are an excellent area to work because most have volunteers and they may want to use this as a retention tool basically. And insurance agents, this is their space and they spend all their time doing this. They're familiar with the products and they can definitely sell in some high volume. So we'll spend the next couple of minutes going over the back office marketing collateral, looking at enrollment forms, and we'll go over the GBR website. So in your agent back office, from the main page, you would click on Library, click on GBR, and under Marketing Flyers, you'll see all 4 flyers are here: Dental, Vision, Vision 1 and 2, this is Terms and Conditions, Select, and Plus. You can open them and download them in English and Spanish as well. Now, you have the ability to edit these forms, and that would be at the bottom. You'd have to save it to your computer first, then open it, because otherwise it won't take the save. You put your name, your phone number, your email address, your website address, and your RxN group number. That identifies you as the agent of record. Now, if they sign up online from your GBR website, you automatically get credit, but just as a safety precaution, you want to put your RxN number down here. You can send these electronically. You can print them out and keep them with you when you're calling on accounts, but you definitely want to download them to your computer if you haven't yet, edit them, customize them, and save them in a folder. I won't go through the rest of the flyers. As far as the enrollment forms, individual forms really you shouldn't be filling out paperwork because I'm going to show you that people can enroll right online. However, if it's an employer-employee group, there is an employee form and an employer form. Whether it be, and that could be actually paid in 1 of 3 ways. The employer could say, this is a great benefit, I'm going to pay for it for the employees, and it's a single form of payment, or it could be a dual payment, but a single form of payment through voluntary payroll deduction, or 100% payroll deduction. As long as there's one form of payment, then that would definitely qualify for those forms. And then if the employer said, not interested, but if you want to talk to my employees and they want to sign up individually, that would be an individual form which you can actually do online. So your GBR website can be accessed, well, most of you guys, not all of you, most of you, from your RxCut site. There's your BizOp site, and here is dental and medical discount programs. Now, there are some agents on the phone. I believe the USABG guys, you don't have these links here because of the special arrangement. So your Get Benefit Relief personal website would be getbenefitrelief.com / and your RxN group number. That would be your personal GBR site. So on the site, folks can actually sign up for any of these products by enrolling right down here. And when they do sign up, they'll select the plan, put in their information, and it would actually go to a secure payment site from here. They can find out product information for all the products, the standalone dental, with some savings examples, the vision program, the select program, which includes the dental, vision, hearing aids, and vitamins, and the plus program, which goes into detail, especially on the telemed or telehealth piece. Health savings actually gives some I guess, how much average savings per year on the different programs. There's an FAQ, frequently asked questions section, and a provider search as well. And in here, they would just click on dental. And this is already, I guess, at a 75244 area code. But it would give all the providers, you can actually download them on an Excel spreadsheet. Very easy to use, and you can even narrow it down by specialty. So you can see all the providers that are in your particular area. So that's the GBR website. Now, as far as enrolling or submitting orders, I should say, there are actually 2 ways to submit orders. One, is faxed to 609-257-0909, which should be on the enrollment forms anyway. And the other way is to scan and email them to gbrforms@ffaemail.com. And there are 2 fulfillment options. One is by mail, which includes 2 hard plastic benefit cards and a brochure. That's a one-time setup fee of $4.95. And this is what comes in the mail. Really nice package. These are actual solid plastic cards, not like our pharmacy discount cards, which are high quality but not plastic. So that pays for the fulfillment. And it's a one-time charge of just $4.95 processing to get this out. The other way folks can't get them is electronically. They'll receive an email containing cards and brochures as attachments they have to print out. But believe me, folks, for the $4.95, it's definitely worth it because it has much more of a perceived value than a paper card, and they're more apt to put it in their wallet. Either option takes 7 to 10 business days. So to summarize, the problem, healthcare reform, creating double-digit rate increases. Most insured have now higher copays and deductibles, and employers are forced to eliminate ancillary products and, of course, raise those deductibles and copays. And the wait time increasing in physician offices. The cure? GBR can help ease the pain. It saves time and money, and it is an excellent wow benefit to the employee from the employer. Basically, for $3 a week, you can ensure that your employee is going to have these great benefits and to be more productive because they don't have to miss 3 hours of work with a sinus infection. They can make a phone call from the comfort of their home office and pick up their prescription on the way home. These products fill the gaps created by healthcare reform. The premiums anyone can afford. Anyone. In fact, all you folks on the call should have this because if you took the Plus program, it costs $12.95 per month, but your net after your commission is $9.45 per month. And once you've experienced the services, then you're like a walking testimonial. We have some agents that have some great feedback that have saved tons of money on the dental piece. And it pays commissions for as long as the account stays active, which is 2+ years. Okay, I busted that pretty quickly tonight, so I'm going to answer a couple of questions. Is this health policy available for us to print out? Yes, it is. I just went over that in your back office. Will this presentation be available in the back office? I'm not sure. I'm recording it, but the problem is, folks, if I record these every week, I should say, I'd be the only person on the call. So I tried not to make it a point to record them, too often. Children covered at what age? Well, there's no age requirement at all. There's no eligibility requirement. So it's an infant on up, especially for the teledoc. They have a full staff of pediatric physicians. Obviously, if it's a life-threatening condition, you want to get that kid to the ER. But if it's a typical ear infection, things of that nature, they say 70% of what people typically go to the ER and urgent care for, plus pay a huge out-of-pocket. The other thing, not only are you wasting your time, but you're paying a $50, $100, maybe $30 at the ER. It's going to be a lot more, closer to $300 and $100-some at an urgent care. If your kid's sick on the weekend, you're not getting an appointment with your pediatrician. He's out fishing or golfing somewhere. Anyway, folks, it looks like that's all the questions. Actually, I got through this much quicker than I thought. Get familiar with the product. There's trainings in your back office. There's 2 GBR training videos. This may or may not be available later in the week. I have a 28-year-old child living with you. That's fine. As long as he's in the household, he's your kid, he's covered. So it's covered in the package. Make sure you mention this product while working and distributing your cards. You never know how many people would be interested in this, especially for the price points. So spring is here, folks. It's time to spring into action and ramp up your business efforts. Join us again next Monday night, same time, same station. Guys, you have a great night and an awesome, productive week. We'll talk to you next week. Take care.